Hello, this is Marquel Thomas, and for this week's discussion, I will be discussing rubella and vitiligo. Rubella is an RNA virus. Humans are the only reservoir. This is seen more in adolescents and in young adults. Infection spreads through nasopharyngeal infection. The virus has been isolated in blood, breast milk, and the conjunctival sac and urine of those infected. The pathophysiology. Rubella is spread via droplet contact or direct contact through respiratory secretions. The virus multiplies in the cells within the respiratory system, followed by viremic spread to target organs. Clinical manifestations of rubella include a rash, the limps, and a low-grade fever. This condition also has 3 stages. The first stage is the prodrome stage. Symptoms of fever of 101.5, lower GI upset, a sore throat, eye pain, malaise, and headache are all included in the first stage. The second stage involves the lymph nodes. This begins within 24 hours and lasts longer than a week. Only the primary lymph nodes are involved, and oftentimes splenomegaly is noted. The third stage is the rash, which includes the Forheimer, and this might occur before general rash occurs. It consists of small rose-colored reddish spots on the soft palate, but is not pathogenic. The rubella rash is often the first sign of illness. It begins on the face and it might fade before it spreads to the chest. However, it is usually gone by the 3rd day, and there also may be some itching. Diagnosing rubella is usually done by clinical symptoms. Real-time PCR of the nasal or throat are preferred specimens that can detect the virus. Supportive treatment, such as using antipyretics for fever, is usually sufficient unless complications occur. Parents should be educated on the importance of keeping children home for a week after the rash erupts. They should also be educated to utilize active and passive immunity. Next, I will be discussing vitiligo. Vitiligo is a common disfiguring autoimmune disorder that can have a negative impact on an individual's quality of life and self-esteem. This condition is the absence of skin pigment that results in the skin being white or light colored. This could also be hypopigmentation. This condition can either be acquired or congenital. The pattern in which this condition emerges is either diffuse or localized. Vitiligo is believed to be an autoimmune disorder. Vitiligo is commonly known as multifactorial polygenic disorder and has complex pathogenesis. It is regularly linked with both genetic and non-genetic factors. The deficiency of melanocytes in vitiligo skin with melanocyte loss owing to their liberation. The liberation ends in progressive melanocytes being reduced. Hypopigmentation follows inflammation or injury to the melanocytes in the skin, resulting from conditions such as sunburns that are severe, injury from liquid nitrogen, psoriasis, or abrasions. Clinical manifestations. Occurrence of any systemic or skin disorder, any recent trauma to the skin, onset of depigmentation, recently or at birth, or family history. Physical exam reveals flat milk white macules or papules with scalloped diverse borders of various sizes. Asymmetric or symmetric, possibly succeeding a nerve segment. This is usually seen on the trunk and face. Vitiligo is diagnosed based on clinical features. However, some tests may be indicated, such as a CBC, thyroid function, antithyroid antibodies, fasting glucose, VDRL, early morning serum cortisol. A Woods light may be used sometimes. This is helpful for those individuals that are fair-skinned. This can help to determine the difference between normal skin and depigmented skin. There are various types of treatments available for vitiligo. These include systemic and topical medications such as calcium inhibitors, which can eliminate atrophy. On average, around 40 to 90% of PEDS patients have shown a response to these treatments. Corticosteroids and vitamin D analogs have also been used. Phototherapy is another option and has proven to be effective. It stimulates repigmentation in most of the clients with early disease. Excimer laser therapy is also used for treating limited, stable patches of vitiligo. Finally, surgery is considered an option, and what happens is vitiligo is localized and is restricted to just small areas. Agents that cover up the skin, such as skin dyes and walnut oil, may also be used. Education is important. These parents need to be educated on how treatment is not immediate and that treatment is likely to fail. This is important because treatment is extremely inconsistent in different patients being treated. Follow-ups for vitiligo consist of a psychiatric consult due to this condition having an effect on an individual's quality of life and their self-esteem. Thank you, and the references are included.